International Women's Day is a celebration for every achievement ever accomplished by women and girls in diverse aspects, such as social, economic, cultural, political, and diverse spheres. And also, it's a day to commemorate the inequalities that women have had ever since the life started and raise awareness of the work left to be done to achieve this equality. My name is Daniela Meneses. I'm a medical doctor. I work as a general physician here in Ecuador. In leadership-wise, I also work in the advocacy area, especially for SRHR in my country. I'm part of different organizations, and we strive to get all the sexual and reproductive health and rights that especially young people, but everyone deserves that. And also in the healthcare area, I work to promote these rights, especially with young people. If I would showcase only one day, you would probably see me at the hospital. I do 24-hour shifts, so I stay at the hospital for 24 hours. I work more in the surgical areas, especially OBGYN and neurology. I work at 2 different clinics, and so I'm taking care of the inpatient wards, and I love it. We also have emergency, where we have seen some cases of COVID-19 right now. And well, in the gynecology area, it's amazing because you really get to work with sexual health and reproductive rights for women. We also empower them. We try to give them like a holistic treatment, not based only on the physical health, but also on the psychological areas. And we also work with different areas that may really help women. That's one thing that I do, but I have also enjoyed working in different NGOs and especially in the advocacy area. So I have been working, I work as a national coordinator for one organization that emphasizes on family planning. So we do projects, we develop policy briefs for the community here in Ecuador. That's one thing. And I work at another organization, so we're always like building projects, trying to see how can we really get to the young population especially. I enjoy both works so much, so it's hard for me to pick just one. So I try to balance the situations to work one day at a clinic and the other day working on my advocacy areas, and have time for myself as well. And the other day I would probably go to another shift and try to balance the situation like that.
So this is me waking up very early, getting ready for work. I get out, go walk into work because it's very close. Here it's me getting to one of the clinics where I work as a medical doctor, getting ready to begin the day, scrubbing in. The day begins with surgery today. So we get to the operation room. We get the patient ready, we prepare him, and I also collaborate during the surgery. I also write reports on patients. We discuss some cases. We like to make sure everything is going smoothly and that they are okay. Since I work at 2 clinics, this is another day in a different clinic. Also getting ready, wearing a mask. Don't forget your mask. Washing my hands. I was also preparing for a surgery. We have many surgeries during the day, and we discuss the different cases, prepare the patient, and I also collaborate during the surgeries. After the day is done, I get home, take a shower, drink my coffee. I don't live without coffee, and also have breakfast, which is my favorite food. After I'm done with breakfast, I am absolutely ready for a run. I go to the park. It's amazing to have nature so close by. After that, I do some advocacy work with one of my colleagues and one of my best friends too. Then I catch up with my meal. Sometimes at night, I like to do yoga. It helps me relax. And finally, get my things ready for the next day and go to bed. Bye-bye.
So in my community, you have to keep in mind we have a very patriarchal society. We have been hit very hard by the COVID-19 situation. We are probably one of the most affected countries of the region, of the South American region. So you have a diverse society. We have 4 different regions in the country, and each one has their own problems, but at the same time, we share some difficulties as an entire community. We have many women we're more women than men in Ecuador, and still more of the high roles of the society are being accomplished by men instead of women. This pandemic has definitely showcased all the inequalities that we have in every area, like work-wise, women are being more affected than men. In also like healthcare, more women are having a more difficult time accessing all the resources. And you have seen like all these different situations that the COVID-19 pandemic has brought. We have, like, for instance, women are having like 2 jobs as the basic member of the society, having to take care of their children and take care of the house, and also at the same time do the work that they usually do. So it's like all the situation for them has been very, very complicated. We're also in what's really going on right now. We have elections soon. So we are seeing that COVID-19 situation, it's been a secondary priority. It's not been really a priority. I think medicine is especially one area that lives in a patriarchal system. It has always been like that, and unfortunately, it's been really hard to change that. But I think that somehow this pandemic has made it possible, or like amplified the lens to the work that women are doing. I think this is worldwide, not only in my country, but we have seen many women that are like being highlighted for their amazing roles in epidemiology, in different areas, but especially like in healthcare, in epidemiology, in public health, in health policies, that probably are roles that, especially here, haven't been taken by women before. So right now it's like, this is amazing because it's given more opportunity to other women that work in that areas as well. We have actually more women than men working in the healthcare areas, but you don't see them as in that high roles, or like medical directors of hospitals, or like the Ministry of Health is also a man. But little by little, we have created like the necessity to advocate for more women being able to access to these roles. And I think that is also thanks to the pandemic. We're advocating for making like the economical situation friendlier situation for women. Also, we have we're encouraging women to access to new types of business, and I think that is amazing, and it's definitely become like the new normal thing for women to have their own and independent source of income for their houses. One thing that we're still like struggling to get more attention to, but we have seen that this year has also showcased the inequalities for the healthcare access and the sexual and reproductive health and rights information that women can have. So you have more women, more organizations that are advocating for these rights and to the access to information. And this is definitely women working for women. So I think that has been a remarkable thing to say about the pandemic. More female as presidents, as head of states, but also like in the healthcare area, as I said, there are not many women having like these high roles. So I would love to see more women being working as a director of hospitals, as the Ministry of Health, and like being the head of these ministries and all the different organizations that work to access this. So I think that's amazing. I want to see more women leading research, for instance, on different topics, not only healthcare, but we have many other branches as well. And more women occupying like these amazing charges. I want to see less of this competitive situation that sometimes it's given between, like, you have only one position, so you probably put like 2 women, you are the only ones that can access to that, so you have to compete each other. And it's not always about competing with each other, but to helping and to uplifting. We can work together, and I think we need more of that like friendship or whatever you want to call it, but definitely we have to support each other in order to progress the entire gender, I think you could say. So that's what I want to see.